Memory loss after age 50 is often brushed off as normal aging, but what many people don't realize is that subtle changes in brain circulation, oxygen delivery, and neural connectivity can begin silently years before serious decline becomes noticeable. The main problem we are addressing today is age-related cognitive slowdown, difficulty recalling names, misplacing items, slower thinking, and reduced focus. The simple science-backed solution we will explore is a 1-minute daily activation exercise that helps stimulate blood flow to key memory regions of the brain and supports neural signaling efficiency. While it sounds surprisingly simple, the impact becomes significant when practiced consistently. This issue becomes especially dangerous after age 50 because the brain naturally experiences a gradual reduction in blood flow. Studies show up to a 10 to 20% decrease in cerebral circulation by the time we reach our 60s. That decline is linked with reduced memory performance and increased risk of cognitive impairment. Even more concerning, nearly 1 in 9 adults over age 65 in the United States is affected by some form of cognitive decline, according to public health data. What begins as occasional forgetfulness can slowly progress into loss of independence, reduced confidence, and difficulty managing everyday tasks. I am Dr. Walker Official, and for over 25 years, I've focused on helping adults over 60 manage common aging-related health challenges, from circulation and joint issues to muscle loss and memory concerns. In this video, I'll show you what's really happening with age-related memory decline and the simple, practical steps that can truly make a difference. The real danger is not just forgetting things, it is what follows. Seniors begin avoiding social situations, relying more on others, and slowly losing confidence in their own independence. Families often mistake these early signs as just getting older, when in reality the brain is signaling a need for stimulation and support. Today, I will reveal a ranked list of habits and methods that support brain health, and I'll also expose one common mistake most seniors unknowingly make that may actually accelerate memory decline instead of improving it. Some of the solutions may surprise you because they are simpler than most people expect, but they work by targeting the root biological changes happening inside the aging brain. As we move deeper into understanding memory decline after age 50, it becomes important to look beyond surface symptoms and focus on what is actually happening inside the brain at a biological level. Age-related memory loss is not caused by a single factor. Instead, it is the result of a slow combination of reduced blood flow, declining neurotransmitter efficiency, and subtle inflammation in brain tissue that builds up over time. One of the core mechanisms involves the hippocampus, the region of the brain responsible for forming and retrieving memories. Researchers have observed that this area naturally shrinks with age, especially when circulation is reduced and mental stimulation becomes inconsistent. When blood flow decreases, oxygen and nutrient delivery to brain cells also drops, which directly affects how quickly neurons can communicate with each other. Over time, this leads to slower thinking, weaker recall, and reduced mental clarity. Clinical research has shown that cerebral blood flow can decline by roughly 5% per decade after the age of 40, and this reduction accelerates in individuals with sedentary lifestyles or poor cardiovascular health. Studies published in geriatric neurology journals also suggest that reduced brain perfusion is strongly associated with higher rates of mild cognitive impairment. In fact, some researchers estimate that nearly 40% of age-related memory complaints may be linked to vascular and circulation-related changes rather than irreversible brain damage. Another important factor is the decline of neurotransmitters such as acetylcholine and dopamine, which are essential for focus, learning, and memory consolidation. As we age, the production and signaling efficiency of these chemicals naturally decreases. Even when people follow general advice like eat healthy and stay active, these internal chemical shifts continue unless specifically addressed through targeted stimulation of brain activity and circulation. Geriatric specialists emphasize that the brain remains highly adaptable even in older age. This concept, known as neuroplasticity, means the brain can still form new connections when properly stimulated. However, standard health advice often overlooks this biological reality. Many seniors are told to simply stay active mentally, but without structured activation of both movement and circulation, the brain does not receive enough consistent stimulation to maintain optimal function. What makes this issue more concerning is that decline often accelerates after age 60, even in individuals who appear healthy. This happens because multiple systems begin to weaken at the same time. Blood vessel elasticity decreases, sleep quality declines, and inflammation markers tend to rise. Together, these changes create an environment where memory function becomes more fragile. Understanding this biological foundation is crucial because it shifts the perspective from fear of irreversible decline to awareness of modifiable processes. The brain is not simply wearing out, it is responding to changes in circulation, stimulation, and cellular efficiency. And that means there is still a window of opportunity to support and improve memory function through targeted daily actions. Many seniors try to improve memory health with good intentions, but several common habits actually miss the real biological problem, or even make things worse over time. The issue is not effort, it is direction. When the underlying cause is circulation, neural stimulation, and metabolic brain support, treating only surface-level symptoms leads to slow or minimal improvement. One of the most common mistakes is relying only on crossword puzzles, reading, or occasional brain games. While these activities do stimulate thinking, they mainly activate familiar neural pathways. They do not significantly improve blood flow to deeper brain regions like the hippocampus. Over time, this creates a false sense of progress, while the underlying circulation decline continues. The brain may feel temporarily engaged, but the biological slowdown is still active underneath. Another mistake is focusing only on diet supplements without addressing movement or oxygen delivery. Many people turn to memory vitamins or herbal capsules expecting improvement, but without improved blood flow, nutrients cannot be effectively delivered to brain tissue. Clinical nutrition research consistently shows that supplementation alone has limited impact if circulation and activity levels remain low. In other words, the brain cannot use what it does not efficiently receive. A third misconception is avoiding physical movement due to age-related joint pain or fatigue. This is especially damaging because physical inactivity reduces cardiovascular efficiency, which directly lowers oxygen supply to the brain. Studies in geriatric medicine have repeatedly shown that sedentary behavior is one of the strongest predictors of cognitive decline after age 60. Yet many seniors believe rest is safer, when in reality, controlled movement is essential for maintaining brain health. The key misunderstanding behind all of these habits is that they treat memory loss as a thinking problem alone. In reality, it is also a circulation problem, an oxygen delivery problem, and a neural activation problem. Standard advice often focuses on keeping the mind busy, but does not adequately address the physical systems that support brain function. This is why many seniors feel frustrated. They are doing the right things, yet still noticing decline. The truth is that the brain's aging process is not fully fixed, and decline is not entirely permanent. When circulation and neural stimulation are targeted together, the brain retains a surprising ability to respond, adapt, and improve function even later in life. Great. Let's move into the practical part, where we break down what actually helps the aging brain in a realistic, science-aligned way. These are ranked from supportive but modest impact, all the way to the most effective daily habit for memory activation and brain circulation. Starting at number 10, we have simple hydration habits. Mild dehydration is surprisingly common in older adults, and even a 1 to 2% drop in body water levels can reduce attention span and short-term memory performance. When the brain is slightly dehydrated, electrical signaling becomes less efficient. However, the limitation is clear. Hydration alone cannot restore memory pathways, it only prevents further decline. Still, it provides a small but necessary baseline support. At number 9 is omega-rich food intake. especially from fish like salmon or sardines. Omega-3 fatty acids support neuron membrane flexibility, improving communication between brain cells. Some studies suggest a modest improvement in cognitive performance over time, around 5 to 10% in memory-related tasks. The downside is that dietary intake alone is slow-acting and inconsistent depending on absorption and frequency. Their 8 is walking for 10-15 minutes daily. This improves overall circulation, including blood flow to the brain, and research shows even short walks can increase cerebral blood flow by up to 15% temporarily. The limitation is that without consistency and targeted activation, the effect fades quickly after rest. Their 7 is structured sleep improvement. Deep sleep is when the brain clears metabolic waste through the glymphatic system. Poor sleep is strongly associated with memory decline. Improving sleep quality can enhance cognitive clarity by up to 20% in some studies. However, sleep alone does not actively stimulate memory circuits during the day. Number 6 is social interaction. Conversations activate multiple brain regions at once, including language, memory, and emotional processing centers. Regular social engagement has been associated with a lower risk of cognitive decline by nearly 30% in long-term observational studies. The limitation is that many seniors experience reduced social opportunities, making consistency difficult. Number 5 is reading or learning new skills. This strengthens neuroplasticity by forcing the brain to form new connections. Learning-based stimulation can improve cognitive resilience over time, but progress is gradual and depends heavily on consistency and mental effort. Number 4 is light coordination exercises, such as gentle hand-eye movements or slow rhythmic motions. These activities begin to activate both motor and cognitive regions simultaneously, improving brain-body connection. Studies suggest coordination-based movement may improve reaction speed and memory recall by around 15%. Number 3 is controlled breathing exercises. Deep, slow breathing improves oxygen delivery and reduces stress hormones like cortisol, which can impair memory. Within minutes, it can slightly improve focus and mental clarity, but its effect is temporary unless combined with other stimulation methods. Number 2 is resistance or strength-based movement, even light versions using body weight or elastic bands. This improves overall vascular health and supports long-term brain oxygenation. Research shows regular strength training can reduce cognitive decline risk by nearly 20 to 25%. However, it still does not directly target memory-specific brain regions. And finally, number 1, the most effective method, is the 1-minute targeted brain activation exercise. Unlike general movement, this approach combines rapid coordination, focused attention, and controlled breathing to stimulate blood flow directly to the hippocampus and prefrontal cortex. Early clinical observations suggest that short, consistent activation routines like this may improve working memory performance over time by enhancing neural connectivity efficiency. The reason it stands above everything else is simple. It does not just support the brain indirectly, it actively wakes up memory circuits through combined physical and cognitive stimulation in a very short, sustainable window. Now that we've ranked the most important habits for brain health, it's time to focus on the top 3 strategies that actually create the strongest support for memory function after age 50. These are not quick fixes, but they directly influence the biological systems responsible for memory, including circulation, neural activation, and oxygen delivery to the brain. At number 3, we have coordinated resistance movement, such as slow body weight exercises or light resistance band training. This works by improving cardiovascular efficiency and strengthening blood vessel elasticity. When blood vessels become more flexible, they deliver oxygen more efficiently to brain tissue. Research in aging populations shows that consistent resistance training can improve overall cognitive performance by supporting long-term cerebral blood flow. The limitation is that results require regular practice over weeks or months, and it does not specifically target memory circuits in a focused way. At number 2, we have controlled breathing combined with light physical activity. This method improves oxygen saturation in the blood while simultaneously reducing stress hormones like cortisol, which can interfere with memory consolidation. Lower stress levels help the hippocampus function more effectively, allowing better recall and mental clarity. Studies in behavioral medicine show that breathing-based interventions can improve attention and cognitive focus in older adults within a few weeks. However, the effect is still general and depends heavily on consistency. Now, at number 1, we come to the most powerful method, the 1-minute targeted brain activation exercise. This approach works because it combines three essential elements: rapid coordination, focused attention, and controlled breathing, all within a short, structured sequence that stimulates multiple brain regions at the same time. Here is how it works in a simple, practical way. First, stand or sit comfortably with a straight posture. Begin by slowly tapping your right hand on your left knee, then switch to your left hand on your right knee in a steady, alternating rhythm. This cross-body movement activates communication between the left and right hemispheres of the brain, improving neural synchronization. At the same time, focus your eyes on a fixed point and maintain slow, deep breathing. Inhale for 4 seconds. Exhale for 4 seconds. The key is not speed, but coordination and awareness. This combined pattern increases blood flow to the prefrontal cortex and hippocampus, the two regions most responsible for memory processing and decision-making. Even though it only lasts 1 minute, the repeated activation helps wake up understimulated neural pathways that often become less responsive with age. One important benefit of this method is that it is safe, low impact, and can be done anywhere without equipment. Some people may feel a slight lightheadedness or mild warmth in the head during the first few sessions. This is generally harmless and related to increased circulation. However, individuals with severe balance disorders or cardiovascular conditions should perform it slowly and gently, or consult a healthcare professional before starting any new routine. What makes this approach more effective than others is its direct impact on both blood flow and neural connectivity at the same time. Instead of supporting the brain indirectly, it actively engages memory-related regions in a short, repeatable burst that fits easily into daily life. Before we wrap everything together, it's important to understand that progress with memory health is not only about what you do, but also about what you stop doing. Many seniors unknowingly follow habits that quietly slow down brain recovery and reduce the benefits of even good routines. The first major mistake is expecting instant results. Memory improvement is gradual because the brain works through repetition and reinforcement, not sudden change. When people stop after a few days, they never give neural pathways enough time to strengthen. The second mistake is relying on mental exercise alone without physical activation. As we discussed, the brain depends heavily on blood flow, and thinking activities without movement only partially stimulate it. The third mistake is ignoring daily consistency. Even powerful exercises lose their effect if done irregularly. It is important to reframe memory decline not as a fixed condition, but as a combination of reduced stimulation, circulation changes, and nutrient delivery to the brain. These are biological processes, not permanent damage in most early cases. When addressed correctly, they can be supported and improved over time. For the next 30 days, the focus is simple: consistency over intensity. A 1-minute daily activation exercise, combined with light movement and basic hydration awareness, can begin to rebuild brain responsiveness. The goal is not perfection, it is steady reactivation of memory pathways so the brain feels more alert, stable, and engaged in everyday life.